I wanted to talk with you today about a really interesting case that happened to a lady in Connecticut. Her name is Deborah Craven, and in May of 2015, Deborah went into Yale New Haven Hospital, affiliated with Yale School of Medicine. So very reputable, good reputation, solid school. This just shows that things, unfortunate errors, medical mistakes can happen anywhere. I don't want to just come on and go, check out this story. You won't believe it, because when I read these, I'm just aghast at all of it too. But I also want to talk about what can be done. What can be done to mitigate a potential error or an error that occurs that causes significant harm to one of us, to a loved one, to a patient. It kind of reminds me of my bosses at the Army hospital that I worked at for 20 years, where the notes on their door said, do not come in with a problem unless you have a solution. So literally you could be there ready to go and then, well, I really don't have a solution, never mind. So I want to talk about it, and then I want to talk about what could be a solution for her case and when you go in for surgery in general. What are some things to be aware of, to be responsible for as a patient advocate? Okay, so Deborah's story goes as follows. She had a precancerous lesion on her 7th rib. All right, so everybody, man, woman, boy, girl, has 12 sets of ribs, unless you are born with one less, one more. But everybody has 12 sets, that would be 24 ribs. And you are to count your ribs starting up here under your collarbone and go down. Okay, so Deborah Craven had a precancerous lesion on her 8th rib. The problem was that even though proper marking was done, because remember about marking, mark the site, talk about it with the surgeon, talk about it with the anesthesiology and your team when you're going in for surgery, when you're going to look at the documentation on your consent form before you sign it. Make sure that you fully understand you're going in for the right hip, not the left, right knee, not the left, right eye, not the left eye, and so forth. So in her case, she had a painful precancerous lesion on her 8th rib. And the marking that took place for her, for better accuracy than, say, just counting and marking on a rib, was that she went into a radiologist at that hospital who put metal coils, one above, one below, to help mark the spot. This is the rib that's going to come out. I'm going to put a metal coil here and here. Here's the section coming out. Apparently, she also had some dye injected. So it would have been clear, had they looked at that in the operating room, that this was the rib. However, it was the 7th rib, not the 8th, that ended up having surgery on. Okay, so after surgery on the 7th rib, not the 8th, they find out their mistake, their error. And they found that out because Miss Craven went home with the same kind of pain, probably worse pain, because now she's got the cancerous lesion on there still. Now she also just had part of her other rib removed. So she goes back to the doctor and says, I don't know if it was her surgeon post-op or somebody else, and says, I'm still experiencing all this pain. Something seems to be wrong. Remember, listen to your body. Talk to somebody about it. If it's not the surgeon, then talk to your family medicine provider, your internal medicine doctor. Go in, and she did go in. She said what was happening, and they did an x-ray, and they said, oh, whoops, okay, the same rib with the lesion is still there. So her surgeon said a mistake has been made. Now, here's where it gets kind of unfortunate, tricky, and complicated, and it could have gone better. Here's what we can learn from it. Deborah Craven did hire an attorney, and she sued the surgeon, she sued the resident or fellow, surgical fellow, she sued the hospital. And what she sued for was, number one, the error. Number two, that when she went back into surgery, she specifically said, I don't want Dr. Corey going back there again. She has the right to say that, right? She should. So she says, I don't want him doing surgery on me at all. But I guess we have to sometimes be more specific and maybe say, I don't want him in the operating room at all. So I can kind of see how the team maybe is thinking, he's a resident. He made the error. He needs to follow through and correct this action here. So he needs to come in with us and work on her to resolve this problem, this mistake that he made. So I can understand that, but miscommunication, because in her mind, she said, I don't want him touching me. And then he went back and touched her again. So she goes back to surgery and she ends up having the 8th rib out, which is the correct rib with the lesion to get surgically removed. But the other thing that Ms. Craven talked about that would have helped her considerably is that she said, they didn't apologize to me. They didn't not only say they were sorry, we made a big error, they also misled me by telling me that I had to come back in for surgery because they didn't get enough of the rib out. It wasn't that they didn't get enough of the number 7 rib out, is that they were supposed to never touch number 7 and they were supposed to take out number 8. Okay, so I completely and wholeheartedly agree that not just in the medical community when medical errors have taken place, but in many other situations, a simple apology goes a very long way. And it makes people feel that you are owning up to your mistake. You are going to fix the problem. You're going to explain how that, I don't know what happened. You're going to explain how that problem occurred and what your corrective action is going to be. So research has shown that saying I'm sorry to the parents of that child, to the family members, and to that patient is critical for the following reasons. Research has suggested and shown that apologizing after a medical error can lead to better outcomes. In what ways? First of all, emotional healing for that patient, for the family members, decreased patient anger, increasing trust, and facilitate a quick resolution. It would be a quicker resolution if you talked it out, decreasing litigation. It would probably be less costly overall for everybody involved if an apology and a conversation occurred right after the error, or as soon as possible after the error. Lying about, covering up, misleading, leaving things out, omitting certain things does nothing but cause more damage, and later on causes such emotional turmoil for that patient because they don't just not trust you, they just don't trust the healthcare system now at all. Showing that you genuinely care, giving something back to that patient and having them be involved in the resolution. This is our idea on how we're going to fix this. Tell me what you think. Oh, I think that sounds good, but I don't want Dr. Corey in there. I hear you loud and clear. We're going to make sure that that doesn't happen. Put it in writing, back into surgery, the consent form. Dr. Corey is not allowed in here. Who's going to, dispute that when they just made a major error, took out your wrong rib? You have rights more than you think you do. I'm listening to the second book written by David Goggins. I love the first one. What's the name of that second book that I'm listening to? It's on Audible. I'll put it up here. Anyway, I'm listening to him talk about the surgery that he had by an orthopedic physician in New York. He sought out the best surgeon for his problem with his both knees, but particularly one knee. And he found out as he continued on with immense pain problems and non-healing issues that the doctor had actually done a procedure that David Goggins didn't even know he did. What did he feel when he found that out? Like betrayed. How could you do that? You're causing me more pain. No wonder. I think I'm crazy. I'm not healing. It's because you did something that caused me to have more pain and more of a healing journey, and you never talked with me about it. So that David Goggins had to end up going somewhere else, getting it resolved by somebody else, but it still leads to all the trauma and damage and lack of trust that was created at the very beginning had that surgeon just been upfront with him. I would say it's really still, in my opinion, in the minority that you have doctors who aren't upfront and who blatantly mislead people. And I know that if you have 5 or 6 surgeries in your lifetime and all of them go well but one, that one makes you feel terrible about all of them. I completely understand that. That's the one you focus on, and that's the doctor in a hospital that you focus on. But maybe, playing devil's advocate here, They are good. They are good doctors. Are they deliberately wanting to completely fuck you up and drill holes when they shouldn't and take out wrong ribs on purpose? I don't think so. This is called a medical error. It was unfortunate, horrible, and inexcusable. Deborah Craven's case highlights the critical importance of surgical accuracy, transparency, and proper follow-up for medical procedures, for surgeries. Let's read about the key factors. Incorrect rib removal despite proper marking. Prior to surgery, radiologists had accurately marked Ms. Craven's 8th rib, the one requiring removal due to the precancerous lesions, with metallic coils and injected dye. Despite these clear indicators, the surgical team mistakenly still removed her 7th rib, not her 8th. Lack of intra-op imaging. Standard surgical protocols often involve intraoperative imaging, such as x-rays or fluoroscopy. To confirm the correct surgical site in Deborah Craven's case, they did not do that. I read somewhere down the road that it was because a machine had malfunctioned. But if that's really the case, they probably would have and should have canceled the surgery. Alleged misrepresentation post-surgery. Following the discovery of the error, Dr. Ricardo Corey, a surgical resident involved in the procedure, allegedly informed Craven that not enough of the rib had been removed, rather than admitting the wrong surgery site at the beginning. I don't know, but I would think that most patients, most family members really don't want to go through this whole process of litigation. It's costly, it's emotionally taxing, it's lengthy, it's just a really hard road to go through. And most people would rather resolve the issue than go through this lengthy, costly, emotionally taxing process. Billions of dollars are spent in malpractice lawsuits and payouts in the United States. Years ago, Stanford in California introduced a policy, a program, when medical mistakes have been made, what their process is to make the patient whole again. And that's really the bottom line here. So a lot of patients are just really angry, like, you didn't even say you're sorry. You didn't even admit to your mistake. You left me out of everything. Now I'm really mad. Now I'm really going to sue you. You've disrupted my life. You've caused more damage, and you've delayed healing and created me to distrust all in the medical profession. But there are simple things that can be put into place that can help dissuade all of that. And the first one being open, honest, transparent communication and 2 words, I'm sorry. Deborah Craven's financial payout is not public. It has not been disclosed publicly, so I don't know anything else about it. Yale New Haven still has a good reputation. Remember, I'm not saying that they're all trash because a mistake has been made, but that it's something to learn from and to be transparent about, because mistakes, that's not the first and last mistake that's going to happen to somebody. What can we do about it? All right, so we can have the best open, honest, transparent dialogue from start, middle, and finish of our time spent with physicians, with healthcare providers, prior to, right before you go to surgery, and after you have surgery. Surgical sites need to be marked, time out have to be taken. It's our responsibility to speak up. So whether it's in the operating room or on the floor or in a clinic, we are responsible to speak up. Housekeeping can speak up. People need to be able to speak up without fear of retaliation. There are laws in place for that now. I do notice, I just find this interesting. I wish somebody had some stats on this. I only have anecdotal stories to compare with. But when errors happen with nurses have taken their own lives out of guilt and shame and no support. Nurses' licenses have been revoked. Their careers are over, and they've gone to prison for mistakes. I'm not saying that doctors don't, but what I am saying as a nurse is it really is different, and standards are high everywhere. Nursing has come a long way, but we still need more support. And like I said, I'm not saying these accidents are intentional. They're not intentional. The doctor didn't say, I want to go to surgery today and purposely take off the wrong leg for amputation or wrong rib or wrong side of the brain. I did something on that too. How does somebody have surgery on the wrong side? But it has happened. And I hope this was a bit interesting to you. It's not just to tell a story, but to also remind everybody that all of us are involved. Be your own best advocate. Talk to your team. It's okay to ask questions. It's critical that you ask questions and that you are completely clear on everything that's going to happen to you or your loved one before you go in for surgery. No question's a dumb question. Please feel free and confident to ask these questions. And if you honestly can't, write them down. Have somebody ask these things for you in your presence so that you can learn and understand what's going to happen to you. If you like things about medicine, if you like oopsies and myths and facts about medicine, healthcare in general, and things that are good for our heart and soul, please consider subscribing. I'll see you in the next video.